You know how to identify a cranial nerve by description, how to answer questions related to cranial nerves, about testing, and if they give you a question and nurse is performing a certain exams, what do you think the cranial nerve is being evaluated for? I think you would like to watch this video, so let's get to it. I have some few questions, about 13 of them, giving you all kind of information about how the cranial nerve can be presented. But this is just practice questions um, basically on the neurocranial nerves. So let's get to it. As usual, straightforward question. This is a straightforward just to introduce you to the problem, and then we will use it because I don't want to mention the names continuously. And next is reviewing cranial nerves before an evaluation. Which of the following pairing is appropriate? So it's a selected apply. You read from backwards. Selected apply. Pairing is appropriate. This is the key word. And then the whole thing is cranial nerve. You have to know what they are, their name. Sometimes they give you the cranial nerve. Sometimes they don't give it to you. So the name changes based on whatever they give you. If they give you the cranial nerve symbol, or they just give you the name. So we just learning it so that we can use it for the rest of the questions. Olfactory, cranial nerve 1. This is accurate. That's the name of it, and that's the symbol. Optic, cranial nerve 2, appropriate. Oculomotor, cranial nerve 3. Number 4 is trochlear, cranial nerve 4. 5 is trigeminal. This is a 3 nerves together. So it's trigeminal. This is a ductal nerve. It's cranial nerve 6. Facial, cranial nerve 7. Vestibulocochlear. This is also 2 nerves involving balance, and that's cranial nerve 8. Glossopharyngeal, cranial nerve 9. Vagus, cranial nerve 10. Spinal accessories, cranial nerve 11, and hypoglossal is cranial nerve 12. There's a lot of information on the internet where it's so many acronyms. There's a bunch of them I don't even want to give you. You may not like them, but go there, find whichever you can recognize, how to recognize the order, and use it whenever they give you a question. But this is the name and the symbol I've given you so that we can use it for the rest of the question. Number 1, taken care of. Now, this is the bulk of the test. Key facts and answering questions based on terms. You know this, but they will present it this way, and you can figure out what they're asking you. Which cranial nerve palsy the nurse should document. That's keywords. That's what you are being asked. What is your case? And next, touch the forehead, cheeks, jaw of the left side of a client with a cotton swab while the eyes are closed, but the client does not feel it. Keywords: forehead, cheeks, jaw, and by touching, light touch, right? Client has trouble also chewing, can chew. Corneal reflex is also negative, it's not there. But the client can do what? Frown the face and puff the cheek. This is how they ask you. I'm being like an examiner, right? Sensation of your face, cheeks, and jaw is controlled by cranial nerve 5. Chewing, cranial nerve 5. Corneal reflex, cranial nerve 5. Frowning and puffing of the cheek, cranial nerve 7. 7 is good, but 5 is defected. So sensation of your face and chewing is mostly by cranial nerve 5. But movement of the muscle, that's facial expression, is by 7. So you have to know. So this is wrong. This is cranial nerve 4. And trigeminal is cranial nerve 5. This is 6. So the right answer is number 3. Okay. Number 2. Number 3. Which test the nurse should perform? Which test do you want to perform? A nurse is caring for a 55-year-old client involved in a motor vehicle accident. The physician placed an order for the nurse to assess the hypoglossal nerve, cranial nerve what? I intentionally give it to you, cranial nerve 12. And you know what cranial nerve 12 does? 7. Number 1, it said what? Shrug the shoulder. Shoulder shrugging is what? Accessory. This is accessory. This is 11. Smile and rising your eyebrows is 7. That's facial. Show the tongue and move it left to right. Yes, this is 12. Cranial nerve 12. Weber test is for balance and hearing. So hearing, mostly you're looking for sensory neural lost, and this is cranial nerve 8. So how do you evaluate cranial nerve 12, which is the hypoglossal? Let them show you their tongue. Show me your tongue. They'll lift it up and they can move it left to right. So this is it. Three down. Number 4. And next, ask the client to read a Snellen chart due to recent 20/40 vision. Which cranial nerve the nurse is evaluating? Select or apply, right? So, which nerve is which cranial nerve is used for the Snellen chart? What do you think? This is visual acuity. Visual acuity is only controlled by one cranial nerve. One is olfactory, is for smell. 2 is optic. This is what we use for visual acuity. Cranial nerve 3 is oculomotor. This is movement of your eyes and other movement. 4 is also for movement of the eye. 5 is the trigeminal, that's the sensation of the face. And 6 is also movement, abducens. So the right answers for the Snellen chart is mostly optic nerve, cranial nerve 2. It's a select or apply. Only one answer choice is there. If you select multiple, you're going to get 0. I intentionally said it that way. One answer. See if you can pay attention and pick those that you're confident. You just have to know the keyword. Snellen chart is visual acuity. There's only one nerve, and that is cranial nerve 2. Number 5. Which cranial nerve the nurse is testing? A client was hit in the face by his friend due to a minor misunderstanding. The nurse asked the client to swallow and make a speech. So talking and swallowing. What is involved? Those are the keywords. You see, I keep on underlining the keyword. Talking and swallowing. We saw cranial nerve 2 acuity, visual acuity. 11, accessory panel, you shrugging your shoulder against resistance. 10 is vagus. That is what you use for speech and for swallowing. 5 is trigeminal, is sensation. So 10. Number 6. Like I said, these are straightforward, but I want to show you what they can do to you. Select or apply. That means there's more than one answer choice here. Pick those that you know you're very confident about, 99.9 or 100.1%. What is the problem? Which test the nurse should perform? So you got to perform the test. A client suffered massive stroke 2 days ago, right? Okay, what happened? The nurse concerned that the client may not be able to protect the airway and want to test for cranial nerve what? 9, glossopharyngeal function before any oral intake. This is one of the cranial nerve that is affected, plus vagus, 9 and 10 when you have stroke. So how does she test for? Close your eyes tightly. That's the muscles of your face moving. When your the muscles in your face are moving, is cranial nerve 7. But the sensation of your face is 5. Say ha. Yeah, say ha is 9. Gag reflex is 9. These 2 can also be performed by the vagus, but this is classic for glossopharyngeal. Say ah can also be both vagus and glossopharyngeal. But for this question, say ah is good. Gag reflex Turn head to the side is accessory. This is 11. Clench your teeth. Okay, when you clench your teeth, that's like move, and clenching of your teeth. Usually, cranial nerve 5 involved. It's also involved. Sometimes the 7 play a little bit of role. Okay, 5 and 7 can do that. A little bit of 5, a little bit of 7. Okay, so this is wrong. This is wrong. This is right. And this is right. And this is wrong. So 2 and 3. So 2 and 3 are good. So those are your answers. Number 7. Which cranial nerve the nurse is assessing? The client is status post. That means he had right eye surgery, right? The nurse want to evaluate right eye movement laterally. That means moving the eyes away from the nose. Okay, moving the eyes away from the nose to ensure no entrapment. Client has been tilting. This is a buzzword, a bunch of buzzwords. Tilting the head to the right. That means towards the area that is injured, which cranial nerve. So let me break it down for you. So I have eye surgery. Okay, this is my face. This one's a little bit hard. I have eye surgery on the right side. This is my right. This is my left. So you have eye surgery here. Okay, this is your nose. And you want to test for the eye movement on the right side. You want to test if these eyes can move, look out without moving your head. So, and the eyes move away from your nose. So the eyes move away. This is your nose. The eyes is moving away from the nose. She want to test that, right? And then what she saw was the client is doing what? Tilting the head towards the area that they had the surgery. So this is the affected side. We call this affected side. And the client is turning the head towards that side. So the head is tilting the head towards that side. Which cranial nerve is assessing? It's not number 2. We saw it, right? It's acuity. Something like that. If you don't understand, let me show you test taking skills. Look at all those that you can really eliminate quickly, and then you can get the answer. You know, 5 is mostly facial expression. Okay, 5 is sensation. Okay, sensation of the face. Therefore, this has to go. And 2 is acuity. So you left with 3, 4, and 6. These are the cranial nerves that move the eyes. So that's why this question is a little bit thinking. There's 3 cranial nerves that move the eyes. 3, 4, and 6. Okay. The one that moves the eye away from the nose is what? 6. And when the 6 is affected, your head will move towards the side that is affected. That's why it's tilting the head towards the right. When 6 is affected, in order to avoid double vision and what we call extortion of to eliminate that, because of that, he's going to tilt the head towards the right. So this is cranial nerve 6 problem. This is the hard one. So select or apply. Same thing, right? Strategy. The next appropriate answer should include, okay, the client wants to know which cranial nerves moves the eye. I already given you the answer. There's only 3 of them. The optic does not. It gives you just a visual acuity, so it's wrong. This is oculo, the name, oculo, eye motor, movement. So this is okay. This is trochlear. That's good. 5 is sensation of the face, and 6 is abducens. So I can tell you 3 and 4, it moves the, what it does is it lets you look towards your nose. So the eyeball look inward and downward towards the nose. The 6 eyeball move away, and the 3 is usually involved in all kind of movement in addition to accommodation of the pupil and the size and other things. So 3 can do all these things at the same time. It does most of the oculomotor. That's why it has the name oculomotor, because it does a bunch of movement. But it also do your pupil size and regulating accommodation. So for this particular question, it's just asking you for eye movement. So 3, okay, 4, and 6. You had the right answer. Select or apply. Once again, pick those that you know. If you can pick 2 out of this, that's fine. Number 9. The nurse knows that the client has intact. Look at it. It has intact. That means patient has correct problem. There's nothing wrong with it. It's intact. The nerve is functioning. The client smiles. 1, raises the eyebrow. 2, pops out the cheek. 3, closes the eye tightly without difficulty. Can distinguish different tastes. This is a trap. Just distinguish taste doesn't mean it's the tongue problem. No. Look at the whole totality. Eyebrow, what that is, I'm moving my face. I'm puffing my cheek, moving my face, closing my eyes tightly so that you don't even open, moving my face. That is all muscles of your face moving. And what nerve involved muscle of the face is the facial nerve. It's also control taste. So most of your taste bad is by that. Therefore, which nerve is intact? It's mostly the one we're testing for is what? The facial nerve, which is cranial nerve 7. It doesn't mean this is defected. Basically, we are looking the answer choice. Which nerve does he see? The nerves know that the client is intact. If I see all these things, I know your cranial nerve 7 is intact. That's what he's telling me. This does not relate to cranial nerve 2, doesn't do this. Cranial nerve 5 doesn't do that. 12 doesn't do this. 11 doesn't do that. So those are all. It doesn't tell me anything about that. Number 10, we almost done. The next knows that the client has possible injury. Now we're looking for injury to which nerve? The client was not able to stroke the shoulder. You can stroke the shoulder or turn your head side to side against resistance. So I put my hand on your cheek and I ask you to move it with your head. Or I put my hand on your shoulder and I ask you to stroke your shoulder against my resistance. If you can do that, there's something wrong. Facial nerve, we saw it does not do that. Movement of your face and your sensation of your tongue. Movement of your tongue is hypoglossal. Vagus is speech and swallowing. Accessory muscle is the best. And this one is usually balance and hearing. Balance and hearing. Vestibulocochlear. So this is accessory nerve. Different style of question. I just trying to be funny. Physician order. Please test for vestibulocochlear function on a client in room 356. What will be your next action? Before you look at the answer choice, you got to identify test taking skills. What is this? I know this is cranial nerve 8. And I ask myself, what is cranial nerve 8 do? It's hearing and balance. Then I said, every answer choice, I'm not going to be trapped looking for hearing and balance. Check for pupil accommodation reactivity. That's cranial nerve 3. Check for chewing function. Yeah, it can be 5. Check for vision function. You involve cranial nerve. That's your vision. You can see, right? So visual acuity, cranial nerve 2. Check for ability to hear whispered word. That means you can have a whisper. If your ear is intact, you can hear it. Somebody is whispering at least. So that's this one. Number 32 more. Physician order. Please test for cranial nerve 3 function of a client in room 6666. Next action, eye movement inward. We talk about it, right? Inward is number 4. Yeah, cranial nerve 4 inward, right? Trochlear. Check for eye movement outward, cranial nerve 6. Check for size of the pupil and reactivity to light. That's number 3. This is that. Check for tears in the eyes. What do you think causes tear? Help you tear up. This is and facial nerve. So this is cranial nerve 7. That's why Bell palsy patient, okay, their eyes are all dry. They can tear. They can close their eyes. So this is cranial nerve 7. So the right answer is number 3. Which cranial nerve is being evaluated? A nurse is caring for a 55-year-old client involved in a motor vehicle accident. The physician asks the client to close their eyes and identify a peppermint or coffee without touching it. So this is the patient. You have a peppermint, and you have a coffee, and you ask them, I want you to tell me if this is coffee on my left or peppermint on the right without touching it. I bring it in front of you. How can you, what do you think we are evaluating? My eyes are closed, so it cannot be optic nerve, right? I'm not using my face. It cannot be, this is facial. It cannot be facial. I'm not touching anything with my tongue. Therefore, it cannot be hypoglossal. So it's olfactory. It's smell. If you have good sense of smell, I know some people smell coffee like, I don't know how to describe it. They know where coffee is. They can smell coffee and they can go by. They can find a good place to find coffee. Yeah, this is an olfactory. And finally, last question. Which cranial nerve palsy the nerve should document? And next, notice that a client cannot move the eyeball down on the left side. So if this is the face and this is your left, right, they cannot move it down here. So this is your nose. The patient constantly tilts the head away instead of moving it towards. First, there's keywords. Eyeball down. That means inward towards the nose. And it's moving the head away from the left. So it's moving, tilting the head away from the left. 7, facial has nothing to do with eye movement. We talk about it. This is 4. Let me leave it behind. This is 5. 5 is what? Sensation. This is 6. It moves the eye, what? How does it move the eye? Away, not inside, not inward. And when you have that problem, you move, you tilt your head towards in where the injury is affected. But this guy is moving his head away from the left side that is affected. So this is a trochlear palsy. Trochlear palsy. This is designed to be like a companion. You got to watch it multiple times and be comfortable with all the text so that when you see it in the question, it's easy for you. This is cranial nerve palsy 101. Enjoy. Have a great day. Keep charging. If you've not subscribed, subscribe for more content like that and put your notification on so that you can get a message when I do this. Take care of yourself and have a great day. Bye-bye.